Hello and welcome to this special edition of the My HCPC Standards Workshop. My name is Kellie Green and I am the Professional and Upstream Regulation Lead at the Health and Care Professions Council. Recognising that as healthcare professionals, working in a pandemic gives rise to some particular challenges for you. We've pulled together a number of resources designed to help you meet those challenges. This version of our hashtag MyHCPC Standards Workshop has been tailored to explore some of those challenges and help to support you in overcoming them. The content here is drawn from a number of the resources that we have been providing in our COVID-19 hub that you can find on our website. And if you haven't visited that yet, then please do so. Now, we, like lots of other people, are working from home at the moment. There are a few of us managing this webinar from our laptops in different locations. Some are in the dining room, spare bedrooms, etc. I want to just say hello to my colleague, Holly Butler, our Communications and Events Officer. Holly has organised this event and is managing the technical side of things for us today. We're also joined by Olivia Bird, our Policy and Standards Manager, and Olivia is on hand to help answer any questions that you might have. Now, we hope that the technical side of things will work for us, but please do bear with us if there are any technical hitches, and we'll try and fix them as we go. We want this webinar to be engaging and provide you with an opportunity to share your thoughts and experiences and to ask us questions. To do that, you do need to be logged in to a YouTube account in order to post your thoughts or questions. We have built in a couple of breaks and we'll aim to answer questions and post them at those times, but please start introducing yourselves now to your colleagues who have joined and start posting your thoughts and questions as we go. Okay, let's get started. So today our focus will be on the standards of conduct, performance and ethics. There are 10 standards to achieve and we're going to focus on a few of those today. In particular, we're going to explore scope, how to identify whether you are continuing to work within your scope of practice, safety, how to raise concerns about safety, risk, protecting your health and well-being. We're also going to explore how you can continue to practice in the community safely, which includes exploring those standards that are particularly relevant when providing online services. Now, I think it's important to remember that all of the standards need to be read in the round. They're not prescriptive, but instead provide a high-level framework within which you should practice. This is a good thing. It gives you autonomy and flexibility to practice in the way that you want and need to. It allows for that flexibility for times like this. How to meet the standards and what is and is not appropriate will depend very much on the circumstances of your individual practice and the context in which you are working. That is why we often say that you need to use your professional judgment to assess what is safe and effective practice for you in the context in which you are working. So, what do we mean by professional judgment? It's when you apply your knowledge, skills and experience in a way that is informed by the professional standards, laws, local policies and procedures that are governing your practice. And then you develop an opinion or decision about what should be done. As professionals, you're applying your professional judgment to a range of issues every day. Sometimes you can reach an opinion or decision quite easily, and other times it can be more difficult to decide what is the best and safest option to do. The process, though, for reaching those decisions remains the same. When it's difficult, there are a range of resources and people that can help you, and we're going to explore some of these as we go. So let's think about scope of practice. A number of queries have been coming to us from different registrants about whether or not what they wish to do in work-wise or what they are being asked to do at the moment allows them to continue to work within their scope of practice or whether they are stepping outside of that. So we thought we'd start by exploring this. The standards of conduct, performance and ethics does place a requirement on you to work within the limits of your knowledge and skills. and to keep within your scope of practice. Your scope of practice is composed of all the activities you undertake within your professional role. It's limited to the areas in which you have the knowledge, skills and experience necessary to practice safely and effectively. Your scope of practice is going to be unique to you because it's defined by your knowledge, skills and experience. So when you're asked to, or you're choosing to, work in an environment or undertake a role or task that is not traditionally part of your practice, consider whether what you're being asked or you're proposing to do is underpinned by your primary skills, knowledge and experience. Your standard of proficiency will inform the scope of practice, as will your job description, employer policies and any guidance issued by your professional body. If what you're proposing to do is underpinned by your primary skills, knowledge and experience, then it is probably within your scope, albeit that it may be that you need to refresh some of that knowledge to undertake it safely. If not, then what you need to do is to consider whether it is something that you can undertake safely if you received training, supervision or support. So even if a role is outside of what might be traditionally expected for your profession, this doesn't mean that it is outside of your scope of practice. If you have or can obtain the required skills and knowledge, what's key is ensuring that you can perform the role or activity safely and effectively and legally. So if your employer has or is asking you to move into a new area or role and you do not feel that you have the knowledge or skills required, we would expect you to receive training and or support to ensure you are still able to practice safely and effectively. Now, we can't compel employers to provide you with this training or support, but what we can do is enable you to seek it and decide not to do what you are being asked to do. Use your standards and the additional information we are providing to you to support your position with your employer. Also call on your colleagues, unions and professional body for additional support and representation if necessary. I think when thinking about whether you are working within or outside of your scope of practice, you could ask yourself these questions. If you are being asked to undertake a role or activity that you determine is outside of your scope and you are unable to complete necessary training or receive the support you need to ensure that you can practice safely and effectively, you can refuse to do that role or activity. Remember that some activities are protected by law, and so you should ensure that your registration and status provide for you to undertake any functional activity that is restricted by law. Here we give the example of prescribing. For some activities you may need different or additional registration, and you should ensure also that your professional indemnity insurance is going to cover any new activities or extension to your scope of practice. So I think this probably leads us into raising concerns. Speaking up about concerns about safety or well-being is a vital part of protecting service users, yourself and your colleagues. Speaking up can also help your employers and the services to learn how to better navigate the issues being faced by you, and to work quickly really to reduce their risk, any risk that they present. We know that there have been concerns about the provision of appropriate PPE and about the roles and activities registrants are being asked to undertake at the moment. So let's explore how you can raise your concern about these and other issues. Preparing to speak up about your concern will help you speak up more effectively. So it's important to be clear about why you are speaking up. What is it that concerns you and what outcome are you seeking? What is it that you are going to say or write? So what are the messages do you want to get across? Make your points as clearly as you can, and I think stick to the facts. If possible, identify potential solutions. Think about who you should speak to. Who is the best person or organisation to raise your concern with? It may be internally, it may be externally. We would suggest, though, that you start to escalate your concern if they remain unresolved, and that you should follow any local policies or processes for raising concerns. Think about how you should raise your concern. It might be that you do want to raise it in person at some formal meeting, or you might want to first put it forward in writing. Think about when you should raise it. If there's an immediate risk of harm, then we would suggest you raise it immediately at the time. Or you might want to raise it more when you are ready and prepared for raising it. Think about whether you need to call off, whether you can prepare your case a little bit better by taking just a moment to think through the issues and how you want to raise them, and carry out some investigation first. Keep a written record of your concern. So even if you make that concern in person, you could follow up with an email. You can make your own record of it. Follow up if it's not resolved. So I mean, if you've raised it and nobody comes back to you with any resolution or response to it, then follow it up and escalate it if you remain concerned and feel like it's not being addressed or responded to. There are a number of people who you can turn to for support and help if you are in a place where you feel you need to speak up about concerns. How you raise the concern will depend on the circumstances and the issues, but your options really include raising it at the time with the person, raising it with your manager or HR department, escalating it to more senior management. Your own organisation will have a process for raising concerns and whistleblowing. You should use these. But wider support is also available. Within the NHS, within the NHS in England, you have Freedom to Speak Up Guardians. A directory of current guardians is provided on the National Guardians Office website. The link is there. If you have these, then use them. They are here, and their service is specifically for you to be able to speak to them freely, raise concerns, and they can escalate them and raise them on your behalf. Similarly, in Scotland, you have the NHS Scotland alert line. Similar service, you can raise your concerns there. Protect provides a support for whistleblowers and also a confidential advice line. So if you wanted to speak to somebody more independent, you can raise your concerns with them and they will help you think through how best to manage them. And Speak Up is a free independent confidential advice line that's provided again for employees of the NHS. Don't forget your union. And your own professional body is also here to support you. We've only got some representations at the bottom of this slide, but you all know who your own professional bodies are. All of these organisations can help and support you to raise concerns, or raise concerns on your behalf. They're there to help, so please do use them. So we're going to take a moment now and just pause for any questions, give you a moment to post any thoughts or questions in the chat box. So far we have talked about scope of practice and raising concerns. Remember, you need to be logged in to your YouTube account if you want to be able to post any comment or questions. We will answer as many questions as we can towards the end of this webinar. And your questions are also going to inform us for any further information or guidance that we might provide in the COVID-19 Hub or wider on our website. So just pause for a moment to give you a chance to post your questions. Okay, so if we are ready, let's move on now to thinking about those of you really who are not working within the NHS or on the front line. We know that many of you are trying to maintain a business as usual and continue to provide the care to your clients whilst respecting social distancing and infection control rules. We also appreciate that not everyone is working on the front line or within the NHS, and our guidance adapting your practice in the community, which you can find in the COVID-19 Hub, explains the factors to take into account when deciding whether to continue to practice at the moment, and if so, how you can do that safely. Current government guidelines still require us to maintain social distancing, work from home wherever possible. Those who are vulnerable still are self-isolating, and these measures are going to have an impact on your practice, and if you're working, particularly if you're working in the community. Providing your services online can be an effective way to keep in touch with clients and continue to care for them, even if that care has to be modified or limited for the time being. Your online services, though, need to be provided safely and in line with your standards. You still need to meet the requirements set out in the standards. And in particular, the ones I think we should think about are consent. Ensure that your client or patient consents to the remote consultation. This includes ensuring that they understand any limitations that this will place on your ability to complete your clinical assessment or treatment. Your services are probably going to be restricted at some point by the fact that you're not doing this in a face-to-face environment. It doesn't mean you can't help them still. It doesn't mean that you can't give them some care or advice or some form of treatment that is still effective. But there is likely to be limitations, and these need to be explained. I think the usual rules about capacity to consent exist, but it may be that the person who has capacity in a face-to-face consultation could be more challenged by that remote consultation. So think carefully about the capacity to consent. Do they still have it? Are they able to manage the systems and consent to the treatment that you're providing? Communication is important, and you need to ensure that the service you use enables you to communicate clearly. Make sure that it's not affected by a poor mobile service or a Wi-Fi service, and really the need to ensure that your patient or carer still receive the information they want and need remains. Keep to the same professional language that you would use in formal face-to-face consultations. Don't be more relaxed because it's online and a remote consultation. Keep it professional. Confidentiality is important. You need to ensure really that the system you are using is secure, that you're speaking to the patient themselves or have the consent to speak to another person, for example, their family member, if that's necessary. Make sure really that the patient can move to a place that provides them with privacy. Some of us are living in quite close quarters at the moment. We're surrounded by family members, housemates, etc. Also make sure that you are in a private place and that you're not being overheard by your family or housemates. Record keeping continues to be important, and the requirement to keep records also remains. And I would say that you should identify on the record that the consultation was carried out remotely. Now, if you can't provide the care or treatment via remote services safely, then you should not proceed with this option. It is possible, and there's lots of people that are doing it. So I think keeping in mind these important requirements, thinking them through and just making sure that you're achieving those should enable you to provide some kind of care or advice to your clients whilst we're working in this current environment. Now, as we begin to return to the new normal life that we will have, you're going to be able to start offering greater services. You will need to continue, though, to weigh up the risks to you, your colleagues and service users as you begin to open your doors again and offer that wider treatment options and services and get your practices and businesses back to normal. Let's take a moment then just to think about you. We're all living and working in unusual ways and environments. We've all had to be pretty adaptable at the moment. For some, that work and home life has become incredibly stressful for all sorts of reasons, and we think it's important that you take care of your well-being and mental health. It's perhaps more important than ever, and let's be honest, we all have our vulnerabilities. There's a huge range of resources that now exist to support you as healthcare professionals if you need it. To help you navigate these, we've collected them all on our website, and you can find them in the COVID-19 hub under your health and wellbeing. Actually, I say all, what we've collected there are the main providers. We also provide information to help you develop your own resilience and to manage stress. More wellbeing resources are being developed by us and will follow. At the moment, these can be accessed through the COVID-19 hub, but it may be that there's, as they become a bigger resource, it'll move into a wellbeing section. I think we're conscious that you may have felt and continue to feel pressure to keep working. But we want to reassure you that if your physical or mental health affects your performance or judgment, or it could put others at risks, then you should stop working until you are well enough to return. So please remember that it is okay to stop working. And if you need support, please do use one of the many resources that are now available to you. Firstly, you could start with your employer and your manager, but if you need that more professional help, the resources are there, the services are there, so please do use them. So talking about some of the further resources, here's some of the things that we have available at the moment on the HCPC website. Resources for practicing during this pandemic can be found in our COVID-19 hub. You can access this on from our homepage of our website. You find the link at the top of the page. Now, within the COVID-19 hub, we provide information about how to meet the standards in these challenging times, and we cover all of the standards, the 10 standards that are set out in the standards of conduct, performance and ethics. We provide the wellbeing resources in there at the moment. There are answers to frequently asked questions which are updated regularly. And these answer questions for you whether you are registered with us on a full basis or whether you are on one of the temporary registers that exist at the moment. We continue to provide guidance and information to your employers, your managers, and these can be accessed in the COVID-19 hub as well, or through the employer hub section of our website. Your HCPC hubs can be found at the bottom of our homepage. We produce an employer e-newsletter, which is called Up to Standard. We have sent one of those out during this pandemic to make sure that employers understood what we were doing for the temporary register and also the sort of support that we expected them to be providing to you. If your manager or employer doesn't get that e-newsletter from us, then get them to register and subscribe for it. They can do that through the employer hub. You can keep up to date with us through our blogs and also by reading the In Focus, your e-newsletter that we send to you. If you're not guessing In Focus, again, please just make sure we've got a most up-to-date email for you and we can make sure that gets sent to you. You can also keep up to date with us by following us on social media, and we're providing frequent updates at this time on all of our social media channels, so please do follow us on those. And also this webinar, other recorded webinars and videos are going to be available on our YouTube channel, so you can view them there in your own time and at your own leisure. So I'm going to pause again, just encourage you to post any further thoughts or questions that you have. You can respond to someone else's post if you have thoughts or views on something, and you can also continue to ask us questions in the text box. Remember, need to be logged in to be able to do that. Now, we're going to continue to answer the questions before we close this webinar, so do keep posted and we'll continue to plug away in that chat box as well. Any that we can't get to, we will take away with us, and we will try to then make sure that we find a way of putting those answers into the COVID-19 hub or in any other relevant places on our website. So do visit that as well. So we'll just pause again for you to make any final kind of thoughts or comments that you might want to about this webinar, and then also to ask us any questions. Okay, so keeping in touch with us at the moment, please do keep in touch. Please do ask us questions if there's something that we can help with. Please let us know about information and resources that you might like us to provide. We will look at all of those. Our offices are closed at the moment. We're all working from home, as I mentioned at the beginning here, so we are unable to take telephone calls at this time, but you can still contact us via email and social media. Here's the different contact points you can have for our registration department, fitness to practice, and our policy department. So do contact us via these routes if you have any more questions and stuff that we can help with. Now, just before I stop talking, I just wanted to say that we at the HCPC would just like to thank you all for your work and commitment at this time. We're really grateful. Please stay safe, and thank you very much for listening.